It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomy by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog I shared, federal judge says state must get ventilator kits at home. You can check out last week's blog by clicking on the link below this video. In this week's blog I want to share an article that was published by the APC a couple of weeks ago. And the article says cutting length of hospital stays could lead to big savings for the Victorian health system. The article, as the headline says, highlights once again that cutting the length of hospital stay could lead to big savings for the Victorian health system. The article highlights once again that the public health system in Victoria is very inefficient and could save hundreds of millions of dollars in taxpayers' money if length of stay for patients can be reduced. One way to reduce length of stay is to offer more home health care even in high acuity areas such as intensive care, where way too many long-term ventilated adults and children with tracheostomies take up too many precious, expensive and in-demand intensive care beds. Intensive Care at Home is embracing home health care, and we show to intensive care units, to our clients and to their families what is possible at home instead of keeping patients in intensive care. As long as public health services keep doing what they are doing, millions and millions of dollars of taxpayers' money will be wasted, and high-cost areas like intensive care continue to keep long-term ventilated adults and children with tracheostomies for longer than necessary. At the same time, they are denying patients and families choice as well as an improved quality of life, and in some instances quality of end of life. Intensive Care at Home services can save up to half of the cost for an intensive care bed, improve the quality of life for patients and their families, and free up precious, expensive and in-demand intensive care bed. I put a link to the original article published by the APC website on the February the 10th, 2016, or you can read the article on our website. I would highly recommend it. Thank you so much for tuning into this week's blog, and for more information you can contact me on 041 094 2230 or email me at patrick@intensivecareathome.com.au. That's Patrick with a K. Or just leave your comments on the blog. We're also currently hiring enthusiastic and experienced intensive care nurses with critical care certificate for ventilated clients in Melbourne. We would also like to hear from you if you have a minimum of 2 years pediatric ICU experience, as we have opportunities there as well. You can also check out our career section, and again you can contact me. You can also contact me if you want to find out more about how we can help you, your intensive care units, or if you have a loved one in intensive care with a tracheostomy and is on the ventilator, you can contact us as well. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.